Yes. Ha. Is there any echo? Okay, cool. All right, we're gonna roll. Okay, I'm sure you guys are like super hyped to start working on your rough draft. So I updated the last slide deck that I did for the actual CI paper just to highlight some things and make it a little bit easier. Let's see, there is a raised hand. Is there a question? Type it into the chat. And please, if you guys have any questions throughout, let me know. I'll stop and address questions. All right, so the title page per the template is supposed to look like this. And I also posted an example of a really good clinical inquiry rough draft under the tab marked 25-2 fall lecture. All right, so this is what your cover page is going to look like. The second section is going to be your actual clinical question. If you feel strongly about identifying why you think it's important, like 10 million women a year are diagnosed with hypertension during pregnancy, you can put that there. Now, remember, if you're referring to any data or any background information that appeared in an article, you will have to provide a citation. And keep it short. The clinical question section should be really, really short. Your evidence-based answer. Did the literature support your question in one direction or another? You probably have gone in your topic selection and you thought you were going to find information that showed one thing. It's possible that during your research, you find that you were wrong, and that's okay. Or that there wasn't evidence or good evidence to support it one way or the other. Sorry. Also in this section, you have to tell us overall what the strength of the recommendations for your answer are. So if you found meta-analyses and systematic reviews that supported your answer, you're going to say that the strength of the answer is sort A. However, if you just found some new clinical trials or some cohort studies, then you're going to have to downgrade that to a B. Be very careful with your words, because especially here, words matter. And if you say the literature proved, that's wrong. You have to say something like the literature suggested or supported. Don't use strong words like prove. We almost never do that in medical research because to say something is proven requires an incredible amount of evidence. Okay, your evidence-based answer. Remember, you need to tell us, was it supported? And only was it supported on the evidence, not your opinion. Do not go into a bunch of background information. Like in this section, we don't need you to explain anything. Assume that whoever would be reading your clinical inquiry actually has some medical background. Your evidence summary. This is going to be the longest section of the paper. Here, you need to talk about the actual literature that you used to make your evidence-based answer. You need to talk about things like statistics. Statistics are important, unfortunately. And if you quote a statistic, you need to understand what it means. So when you hit your senior semester and you do your clinical inquiry presentation, if you start talking about Cohen's d, you need to understand what that meant, because if you use it and present it, then it's fair game to be asked about it. And I can promise you that my fellow instructors that hold a DSC, Doctor of Science, the ones that did the surgery residencies, the emergency medicine or ortho residencies, they know what these statistics mean, and they will ask you about them. A nice way to start this section is to make a table. I showed you one in your freshman semester, and there is one provided in the template. When you describe your literature, you should identify the articles by what kind of study it was. Was it a randomized control trial, a meta-analysis? Was it a simple literature review? A lot of times, articles will say, even in the abstract, this was a randomized control trial or this was a systematic review. If they don't, then it's likely just a literature review. To do a systematic review or a meta-analysis requires a very standardized process, whereas just plain old reviews are a little bit more loosey-goosey, and you get to have a lot of more creative freedom in the writing of that kind of article. Other things that you should identify is, what did the study look at? Adults, children, individuals over 18, males over 18. How many people were involved? So if you're looking at a systematic review of 10 randomized control trials of 100 people each, that's pretty good evidence. If you're looking at a meta-analysis of 10 systematic reviews that looked at 10 clinical trials, now you're going to be looking at something like 10,000 people, so a much stronger data pool. What were they looking at, and what did they find? What were the overall conclusions? This is a new slide that I added today to this clinical inquiry rough draft lecture. And I did that because I'm seeing with the junior final drafts and the CIs that y'all were having some trouble identifying what this should look like. This is how you present data. And I want to draw your attention to this. So right here, the article is identified. It's a randomized control trial, and it's immediately followed by the citation. And in this example, because this is the third article that was identified, maybe they identified 2 articles in the evidence-based summary, it has a 3. We identified the number of participants, what the study looked at, what the active and control groups were, and who the participants were. In this example, they were all male. And this particular study looked at adding physical activity and looking for weight loss. The actual data is presented in parentheses. So you had a 95% confidence interval, and the interval itself was 2.47 to 2.99. That was for the first group, the 30-minute group. And then it repeats for the 60 and 90 minutes, and then it gives the overall p-value. We don't present this in narrative form. In medical literature, this is what it looks like when you present statistics. It's boring, yes, but it's clear and to the point. Now, is this an overly presumptive summary sentence? The addition of physical activity provided a significant benefit to weight loss. Can we make that conclusion? Anybody? Anybody? Yeah, absolutely. Is it proven? No, but I'm not saying it's proven. I'm just saying this, based on these statistics, yes, there was a significant benefit. Also, when you talk about the articles and your data, please, 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 please refrain from getting too descriptive. Again, just present the data. Was it significant or not? You do not need to tell the reader what a p-value or a confidence interval is. Anybody reading this already knows that, so you don't need to describe them in terms of a definition. Do remember that the first time you present an abbreviation, you should define the abbreviation. So that's going to look like, you got your parentheses, it's going to be double. For some reason, it's not letting me do capitals, so bear with me on that. Confidence interval. So that's what it's going to look like. Make sense? It's just a different language. Also, in the master seminar page, I have posted a thing called the Wiley Guide to AMA. That is all the information you will ever need about how to write an AMA style. This is a mock-up of the evidence summary table. It doesn't have to be this wordy. You can abbreviate as much as you want. But looking at this table, what can you say about it? Well, the evidence was sort B. Okay. Was the data sound enough that you can say there was a significant change or not? And I would say that here, yes, you could say that. The last section is going to be recommendations from others. And what that means is you're going to look for guidelines or consensus statements from groups. If your topic deals with, well, this example was hypertension in pregnancy, you're going to look for recommendations from the American College of Gynecology. How do I find those? Google it. Just Google, are there any practice guidelines, and put your topic in. And then that should bring up some information, some guidelines from organizations. You do have to cite those, and they do count for your number of references. However, if you only use one article in your evidence summary, that's kind of cheating. I'd like to see at least 2 or 3 articles that you examine without like trying to water down the information by only using one. Does that make sense? It should. In clinical practice, if there are guidelines published by multiple organizations and they agree, and you deviate from that practice, you can get into serious trouble legally if you have a bad outcome. So if you do deviate from guideline recommendations, you need to really document your rationale and be able to support that decision, or you may get into legal trouble. References. Gotta have 4, and for the paper, oh gosh, I'm sorry. This is an error. I will correct this. For the paper, it's 8 years. Published in the last 8 years. For the PICO, it was 5 years. But to actually help you and open this up a little bit so that you have more access to information, for the papers themselves, it's 8 years. I'm making myself a note that I need to go back and correct this. 8 years. This is slide 12. Okay. If you're unsure about how to do the formatting, you can look at the Wiley guide and digest that. Okay. Yeah, that takes some work. Or you can just plunk the name of your article right into PubMed. And then when PubMed finds it, you hit this little button here, citation. And then this is going to pop up. Note here that the format is not what you're looking for, so you just hit that drop arrow. And then you can see here that you can select AMA, and then it will format it for you. And all you have to do is cut and paste into your actual paper, and the formatting will be 100% correct. Work smarter, not harder. I like shortcuts that work. All right, overall, this is a short paper. Most people will find that their initial draft is long. So what I recommend is, as you do your initial draft, write what you think is important. And then when you finish, if you're over that 3 to 5 page limit, go back and start editing. Also, because it's a short paper, using a citation manager sometimes isn't really helpful. So what I do is, as I write, let me go back here a little bit. All right, so like here, what I would do right here, where that citation is, I actually write it out. So I have like a superscript. Let me type superscript. And then once I finish the paper, then I go in and match the citations to my references. That's the easiest thing I've found. Let's see, is the due date of the paper end of the semester? Yes. Yes, last week of the semester. All right. Let me get to where we were just at. This paper is to be written in a formal tone, which means you're not going to identify yourself by saying I, me, we, nothing like that. You might see that in the literature. It is what it is, but I'm asking you to write formally. Also, in formal writing, we never, ever, ever, ever use contractions. And of course, I talked about this last semester. Don't use common expressions of speech. On the other hand, based off. Nope, 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 nope. Stay formal. Now, Formal writing does mean that you have to write incomplete sentences. Formal writing doesn't mean that you leave out the or and. That's something that I see a lot, and it's like, no, still need complete sentences and complete paragraphs. One sentence does not a paragraph make. As you're composing this, be cognizant that APA and AMA are very, very different. APA was fine for your previous coursework, but now you're medical, so that's going to change. You can place a citation for an article immediately after you identify the study or at the end of the sentence where you first identify that study. You don't put it at the end of the paragraph. And while you can say things like Adams et al. 2017 and then put the citation here, where's my little crayon? Nope, that's not a crayon. Can't put the citation right there. That's not favored. The nice thing about using AMA, it's very clean and it's less wordy. So when you start identifying articles by the author name, that's a lot more wordy. Once you drop in a citation, if your entire paragraph refers to that one article, you don't have to continuously recite it. However, if you switch and identify another study in a paragraph, then you have to re-identify the studies with a new citation. There is a penalty for being late, and it's 2 points per day for a maximum of 13 days. Why 13 days? Because after that point, it is mathematically not possible to pass this assignment. What happens if you fail this assignment? Unfortunately, you will be referred to a performance review board, PRB. Does this happen often? No. Oh gosh, no. I can think of 3 students since 2019 that went to PRB because of their paper. Oh, wait, make that 4. There was one in phase 2 that completely plagiarized an assignment for phase 2. They went to a PRB. Okay. I think that, plagiarism. All I'll say about plagiarism is don't do it. Your final submission will go against the plagiarism checker. If you do your final submission and you are confident that you did not plagiarize, but you get a number like your paper is 40%, has been identified 40% non-original material, don't freak out. Please don't freak out. All what that says to the individual instructors, they open up that report and they look at what the plagiarism checker has identified and what you wrote. There are a limited number of ways that you can say things like, let me pull this up. How many different ways can you say 95% CI? You can't. So if I open up that plagiarism report and what I see flagged is all your data, I'm going to 100% ignore that. Also, something that the plagiarism checker is going to pick up is the cover page, because everybody's cover page is going to be the same. So this is always identified as plagiarism. Now, something I will ask that you refrain from doing is putting passages in quotation in quotation marks. And the reason why, even though that protects you from being flagged for plagiarism, it's lazy. You need to reword or paraphrase the information that you read into your own words. And that is it. That's it. There's nothing else to it. What are your questions for me? Oh, and over the next few weeks before the end of the semester, I will make myself available in your classroom for one-on-one help. I think, let me look, the schedule, sophomore, the week before Thanksgiving, I will be in your classroom 2 days. Yes, senior semester, you're going to be presenting what's in this paper. You may change your topic, but I suggest you nail that down quickly and get it vetted and okayed, especially if you're having trouble finding research. And again, you can reach out to me and I'd be happy to help you. Sometimes it may take me a few days to get back to you, just depending on what I have going on. And the CI presentation in the senior semester, it's 5 minutes and 3 to 5 slides, very concise. And it's actually a lot of fun. It's fun for the faculty to see what you guys have done for your research. And I really enjoy the CI presentations. It is a lot of fun for us. Anything else? Oh, also, you guys will be happy to know we talked about this with the program director, and every semester we are going to have a virtual day just so we can debug the system in case we have to go virtual, like, oh, I don't know, if the AC or the electricity goes out. So we're going to start building at least one virtual day into every semester. And I'll try to be strategic about that as far as like where it is in the semester and how it might benefit you guys the most. All right. Any other questions? Thank you guys. Good luck tomorrow in RADS.